But right now, I want to get to Aaron Derfel, the Gazette's award-winning health reporter, talking about something that, I hate to say it this way, Aaron, it's something we should not be surprised about. We've been talking about the population aging and by virtue of that requiring more services in hospitals. But now we're finding out that basically what we believe is beginning to come true and we're not ready for it. Is that fair?
Yes, that's absolutely fair, Aaron. I mean, what surprised me is that, in the case of some hospitals in Montreal, the percentage of seniors above the age of 75 who were seeking care in emergency rooms, it jumped by more than 60% from 2020 to 2024. That was surprising. We would expect it to increase, but not by that much and over such a short period of time.
So the question then becomes, and we've seen the terrible stories about people sitting in the emergency room, in corridors, on stretchers, waiting to eventually be assigned a room. What are hospitals supposed to do by virtue of this, given the fact that at the same time that this is happening, we know that, Santé Quebec has been told you better find $1.5 billion to save. I mean, that seems to basically be completely, in opposition to what would be needed, which is more money, not less money.
Yes, so there's a perfect storm. There's a study that came out today that reported that nationally, and this is the case certainly in Quebec and in Montreal, the number of family physicians is at its lowest in more than a decade. And so, you want to head this off. You want to be able to follow patients, older patients out in the community so they don't wind up in the ER. But if you don't have enough family doctors around, then people sometimes just go to the ER for medical attention because they can't get it anywhere else. And these older individuals have multiple medical problems. One of the things I had discovered is frailty, and that's a serious issue because people in their 80s, sometimes they take a tumble, they can break their hip. And this is something that emergency rooms are not equipped to deal with. It raises the questions: shouldn't they have foreseen this? We knew that we've got this silver tsunami coming, and yet collectively as a society, and certainly the Quebec government, the health ministry, seem to have been in a denial. So the perfect storm is we don't have enough doctors, family physicians to head this off, and Santé Quebec, the new state corporation, it's ordered $1.5 billion in cuts. And this is something that, is going to last not for a few more months or a few more years, but at least a decade as the baby boomer generation, reaches into their late 70s and 80s and 90s.
I know as well you spoke to Dr. Lawrence Rosenberg over at the Jewish, and I read something that you put in here that I thought was interesting, given the fact that we're seeing more and more admissions from people over the age of 65 and 70. He was kind of talking about potentially an idea of a geriatric emergency room. What does that mean? How would that even be possible?
Yeah, so there are initiatives that are being carried out in Toronto and other places where you take into account the type of patient who has issues like polypharmacy, meaning they have multiple medications. And so you have specialists in the ER that can track that sort of thing to avoid drug interactions, social workers, occupational therapists, physical therapists, because not all of this are, deep medical problems. And you just train the staff, you divert those who are above a certain age, you divert them to the specialized unit. I can tell you, what's so shocking and what's so really appalling is in some Montreal ERs, they're calling this corridor medicine. It's not just that you have these patients who are languishing on gurneys and hallways for days. They're not being fed, and some are not even being given a pillow. I mean, I was told this by a Montreal ER. They're bereft of any dignity. Their condition can often worsens during the time that they're lying on a stretcher in the hallway, and there are cases where there's so few staff that they will resort to restraining these patients to ensure that they don't fall or get up from their stretchers, even though they might not be immediately in danger of falling. It's just horrific when you think about it.
What's even more, I guess, concerning here, if I can use that word, is the fact that in the numbers and the projections, this is not anything that's going to change in the next 10 or 15 or 20 years, right? You pointed out this is expected to rise until, 2071?
Yes. The latest projections from the Institut de la Statistique du Québec point to 2071 being, at that point in time. And obviously these things are revised, and I'm sure that the pandemic had some kind of impact, because I think we were supposed to reach that point sooner, but the projection is that 1 in 4 Quebecers will be over the age of 65, and but then at one point in time the pressure will start to taper off. After that, I don't want to sound insensitive, but speaking as from a demographic point of view, no one lives forever. At a certain point, the baby boomer generation, they will,
they'll die off.
Yeah. And so there will be less pressure on the system. But the intense pressure, what we're facing now, and this is what really, why I wrote the story, because when we're talking about the ER crisis, what are the causes? Certainly, there are many causes. Shortage of family doctors, lack of primary care, but it's really the driving force is this rapidly aging population, and it's something that we're going to have to live with really intensely for the next decade.
Just as a final question, when you read we have to shave $1.5 billion off the healthcare system, you wonder, okay, we know this is a situation, we know it's going to get worse, yet how are we going to treat it?
They don't know what they're doing. They're improvising. So you recall Santé Quebec ordered cuts in home care. And this is what, you want someone who's in their 70s and 80s to be mobile at home for as long as possible. Well, they need that home care. If they don't get that home care, they fall down, they end up in the ER. And so what happened is that the health ministry ordered Santé Quebec, this is 2 weeks into its existence, it ordered it to kill that idea. And it just raises questions about, why do we need these, the secondary bureaucracy? If 2 weeks into its mandate, the health ministry overrules Santé Quebec and says, no, you don't proceed with these cuts in home care. And I don't know where they're going to cut, because when we're talking about health care, everything is mission critical. Even if you cut the security budget, it ends up hurting healthcare indirectly in a domino effect.
Describing a pretty grim situation. Aaron, I got to wrap up. I thank you so much. Great job on the article. Appreciate your time.
My pleasure.